Good evening, everybody. I'm going to hand over to Dr. Mzukwa, the chairperson of SAMA, and he will take it from here. Thank you.
Good evening, colleagues. Thank you very much for taking your time out of your busy schedules, to join the South African Medical Association for a special webinar that will address a topic of utmost importance, namely waterborne diseases caused by poor quality of water and sanitation. I'd like to begin by emphasizing the critical importance of addressing water and sanitation challenges in our communities. These challenges, unfortunately, have far-reaching consequences, as we know, especially when it comes to the spread of waterborne diseases. Today, we gather to delve into the crucial issue, understanding the link between inadequate water and sanitation facilities and the emergence of waterborne diseases that pose significant threats to public health. Water is a fundamental resource, essential for all aspects of life, I wanted to say. It sustains us, provides nourishment, and enables countless daily activities. However, when clean and safe water is not readily available or sanitation facilities are lacking, we find ourselves exposed to a range of health hazards. These diseases, such as a recent cholera outbreak in Hammanskraal, you'll recall, colleagues, and various gastroenteritis, intestinal infections, can have a devastating effect on individuals and communities. To tell us more, it is now my privilege to introduce my classmate, Dr. Ntokozo Mzimela, our expert speaker for this evening. Dr. Ntokozo Mzimela, also known as Dr. Bug or Bug Doctor, Bug Doctor. He qualified as a medical doctor in 2005 and shortly thereafter qualified as a pathologist, specializing in microbiology. As a lecturer for integrated microbiology and virology at the Nelson Mandela University, she holds an innate passion for educating communities on the prevention and the cause of infectious diseases. Over to you now, Dr. Ntokozo Mzimela, the Bug Doctor. Thank you.
Good evening, colleagues. Thank you so much, Dr. Mzukwa, classmates. I would first like to share my screen before I continue. Can you see my screen?
We can see the screen, thank you.
Yes, okay.
Okay. So as I have been introduced, Dr. Ntokozo Mzimela, also known as Bug Doctor. I always tell people that I acquired the name Bug Doctor because I teach 2Ks. So when you teach 2Ks, you need to be relatable so they can grasp whatever you're trying to teach them. So it is with great pleasure that I am tasked with this task of giving a talk on water diseases and the challenges affecting water and sanitation in South Africa. So throughout the session, I will delve into various subtopics. I will start off with overview of waterborne diseases, challenges we face in ensuring clean water and proper sanitation. I'll also share on insights into diseases, outbreak and prevention, and whether share on some case studies and stories. But before we kick off, I would like to ask a critical question for all bug lovers out there. And if you don't know the answer to this question, then we might have a problem in your grasping what I'll share today. So the question is, why did the bacteria bring a ladder to a party? I don't know if I'm able to see. Oh yeah, you can drop if you know the answer, you can drop it in the chats, but I'll give you a moment to ponder. And when you're ready, in a few seconds, I'll reveal the answer. Anyone? Okay, I'll reveal the answer since I'm not getting any responses. I'm sure it's happening. So the answer is, it hurt that drinks were on the house. So I hope that you get it and it brought a smile to your face. So let's get back to business, to the serious part, on exploring the fascinating world of waterborne diseases. So waterborne diseases are defined as infectious diseases caused by microorganisms that enter the body through contaminated water sources. So in South Africa, as it has been mentioned, like recently, we have seen cholera outbreak, but there are other diseases that can occur due to drinking contaminated water, like viral hepatitis, typhoid fever, bilharzia, and even malaria that we often see in northern parts of KwaZulu-Natal, Limpopo, and Mpumalanga. So waterborne diseases actually fall under a group of diseases called water-related diseases. So these water-related diseases are classified into 4 types. We classify them according to how you transmit the disease. So today I'll only be zooming into waterborne diseases that you acquire by drinking contaminated water. The other 3 types is the water wash that you acquire when water is scarce, like polio. Water-based disease you acquire when you are in contact with contaminated water, for example, with swimming, as we have been seeing in Durban, some of the beaches being closed due to high levels of E. coli. And lastly, there's also water vector diseases where the infection is transmitted by a vector, but these vectors, they need water to breed. So an example is malaria. So in South Africa, water resource is managed by the Department of Water and Sanitation. So the mandate of Department of Water and Sanitation is set out in the National Water Act of 1998 and the Water Service Act of 1997. Their mandate is to ensure that the water resource in the country is protected, managed, used, developed, conserve, and control, by regulating and supporting delivery of effective water supply and sanitation. So basically, it's just to ensure that safe water is delivered into communities. So in Water and Sanitation Department, they have what is called a blue drop, green drop, and no drop certification. So what this is, it's essentially regulates wastewater service, drinking water quality, and water use efficiency. No drop is basically saying we don't waste water, we use water optimally. But for this talk, the important programs is the blue drop and green drop, which are initiatives that safeguard the quality of the water that we drink. They also protect, the green drop is protecting the environment by promoting effective wastewater management. So they basically use a scoring system to give certification. So the latest report was actually released this year by Minister Mkunu. Water was sampled, water treatment systems were sampled. It was 151 out of 1,035. And the results thereof that I highlighted for this talk, it was reported that 31% water treatment infrastructure was in good condition, which is very concerning. Then with regards to microbiological compliance, which I will explain a bit further on the next slide, only 39% of systems achieved excellent microbiology water quality compliance. So what's microbiology compliance is? It's basically a measurement. So water is sampled, taken to the lab, water is tested if there is harmful bacterial organisms. So it basically tells us, is the treatment process being used working? Is it able to remove the bacteria that are harmful, that can cause diseases? So that sample that is taken needs to meet a standard called SENS 241, which is informed by WHO. So when the water meets the standards, then the water is considered safe to drink. So what I would highly recommend as well, that there is a draft regulation that is open for public comment. You can find this draft regulation on Water Institutes of Southern Africa, NPC. I feel like it's just one document that should go viral, because we always make things go viral on social media. This is one document that where we can contribute to the quality of water that we are receiving. And essentially, the report that was released this year was alarming. It showed us that there's marked deterioration in drinking water quality. The 2012 report reported that 10% of municipalities had bad or poor microbiology water quality, but this year it is 50% of municipalities with poor microbiology water quality. This diagram is just summing up to say, just in this country, if you want to know how clean is your water, is it safe so that you cut down, because you're always walking around with bottled water. But from this blue reports, it looks like it's Gauteng and Western Cape with the least plants that are not compliant. Northwest is leading with 86% of plants that are not compliant. So across the country, it can be seen that most of the municipality do not meet the required microbiological need compliance. That essentially means that the water is contaminated and there's a possibility of acquiring infections. Just to sum up the challenges that we are facing in this country when it comes to water and sanitation, there is lack of infrastructure, and that contributes to limited access to safe drinking water and sanitation facilities, and it's affecting millions of people in this country. Water is also scarce, and we are amongst the 30 countries that lack the resource of water in this country, and also we lack treatment methods to make the water clean, as I've already mentioned. So I looked at a systematic review article that I thought is very interesting to share with the audience today. So this systematic review looks at 18 journals that were published between 2010 and May 2022. The systematic review was just looking at barriers and facilitators to water sanitation and hygiene. We call that WASH in short, practices in South Africa, because if WASH practices are not adequate, that leads to diseases. So in this systematic review, it was reported that the biggest barriers to adequate WASH is geographical inequalities in this country, climate change, no investment to WASH resources, low levels of knowledge on waterborne diseases, and ineffective local community engagement. So for this talk, I felt the last two are the ones that I will highlight more, because I felt those are the things that we can do something about. We can teach people about waterborne disease, and we can engage with communities to teach them about waterborne disease, with what they are and how we can prevent them. So it's very important, even the other three, to understand the challenges so we're able to address them and move forward to making sure that we get safe water. So in summary, the systematic paper just highlighted that our current WASH practices are not aligning to our SDG 6 goal, which is ensuring access to water and sanitation for all. So there are still many areas in this country that lack safe water and where there's poor sanitation. And what can bring us to speed is social capital development. It is important. In most studies, it was seen that it is important to have established network. It contributes positively to improving WASH practices. It also contributes positively to positive attitudes and behavior towards water WASH practices, and also increasing access to latrine, which is toilets, effective local community engagement, as I've already mentioned, and also with putting more money into the WASH infrastructure. And they highlighted that the gaps they identified, we're still not able to mitigate our current barriers, and there's no system in place to monitor if we are able to mitigate these barriers, and to even for facilitators, we don't have a system to monitor and evaluate how that is helping with our dilemma. So I zoomed into basically 4 articles that I thought are interesting. And the first one being the study that was conducted in Northwest. The study investigated the presence and abundance of virulence-associated genes in well and borehole water used for domestic purposes in a peri-urban community in South Africa. So the findings revealed that the water sources were contaminated with pathogenic E. coli strains that carry virulence-associated genes. So this basically says this water had a potential to cause waterborne diseases and outbreak in those communities that were being studied. The second thing that was also of interest, the study highlighted the need for clear policies. Yes, there are policies in place, but they are not clear. And there's also a lack of effective quality control measures for groundwater use in South Africa, and the study was conducted in 2017. So WHO provides recommendation for protecting groundwater for health. This is outlined in a document titled Protecting Groundwater for Health and Managing the Quality of Drinking Water Sources. So groundwater basically is also important water resource as it can contribute to 1/3 of drinking water, to 40% of world's irrigation water, to 25% of the world's industrial water. So it's one resource we must also preserve. So WHO has developed this document to guide how to preserve this resource. So this recommendation, it stresses the importance of implementing comprehensive water quality management strategies, including source protection, monitoring and treatment. And this document also emphasizes what was shared in the study that I've just said, that there is a need for clear policies, regulation, and guidelines to safeguard groundwater from contamination and ensure that this water is suitable for domestic use. What is also of interest in this document, it just guides you step by step where you should construct your ground source. So an example, it will tell you, you must, when you are looking for a groundwater source, you must make sure next to it, there is no possible contamination sources like latrines or toilets next to it. So in South Africa, we do have a groundwater document. It is comprehensive. It aligns with recommendations provided by WHO for protecting and ensuring groundwater is a suitable source for domestic water. So this strategy document, it includes various protocols, strategies, guidelines, and standards that are implemented by the Department of Water and Sanitation. So the third study to look into, it is a study that's titled Knowledge, Attitude, and Practices Survey on Water and Sanitation Hygiene in Selector School in Vembe District in Limpopo. The study was conducted in 2013. It looked at the attitude and practices to wash practices at that point. So at that point, they had a knowledge about waterborne diseases, which was impressive that at that point they knew, but they didn't know the transmission routes of diseases. But it was also noted that some areas still lacked water facilities and sanitation facilities. I did check even recently in Limpopo, there are some areas where there's still a challenge of not having toilet facilities. So basically the study just highlighted was there still a need for targeted education and awareness campaign to improve wash knowledge in the communities. Also another study that was conducted here in South Africa and Zimbabwe. The study was conducted by Mbereva et al. It focused on knowledge and perceptions of schistosomiasis in 2 semi and rural areas of South Africa and Zimbabwe. This article also revealed that there is lack of knowledge about schistosomiasis. Many of the participants in the study had little or no understanding of the causes, the symptoms, and transmission of the disease. But in Zulu, we usually call schistosomiasis isqenene. So I'm not sure how the participants were asked about this, but they revealed that they didn't know about the disease, and they have many misconceptions and myths similar to COVID-19 around this schistosomiasis. So this article also highlights that there is a need for education and awareness for waterborne diseases. So the last study, before I move on to the next segment of outbreaks, it is a study that was also conducted in Limpopo as well. So here they were testing a diagnostic tool for technical compliance. This tool was developed by Mamba and Sword. So it used to assess the water treatment plants and to help with improving the water quality. So the study just reported the same findings, that this tool can be useful because it's a cheaper tool as compared to what's being currently used. So they find that it can be of added value because in the setting where they were testing a tool, there were poor conditions of lab equipment, there was not enough staff, there were no funds, and there were no measuring instrument and laboratory equipment. So this tool could play a role in mitigating all those barriers to making sure the water is tested to see if it meets the required quality. Yeah, so it was a very interesting study as well. So I'll move on to the next segment of just sharing the outbreaks that have occurred in the past, building up to the recent outbreak of cholera. So in 2016, in this article was published in 2016, but in this case, an outbreak did not occur. This was actually the MEC picking up that there is a potential risk of an outbreak because during that period there had been flooding and there were bursts of river banks. Then it affected the river Kochuske River. It's one of the longest rivers in Gauteng, and it flows into many industries and semi-rural areas. That's why there was a great concern that there might be infections. So the water was tested and E. coli was high. So the outbreak response team was dispatched to this river. So they lucky, no cases were reported, but then it was a good point to educate communities on E. coli and how to prevent waterborne diseases. And in 2017, actually, it's an actual outbreak that happened in the markets and South Coast, where more than 600 cases were reported over a 3-week period. So what had transpired there, sewage contaminated the lagoon, and it was during December, I think, yeah, it was during holidays, school holidays. There were many visitors in the South Coast, and they all drank this contaminated water. This water was found to have tested positive for norovirus, astrovirus, and rotavirus. Yeah, and then there was an outbreak in May 2022 in Durban as well. No, my bad. No, there wasn't an outbreak. So in 2022, there were heavy rains in Durban. So because of the damages to the infrastructure at that point, so there was a great concern that there will be a potential outbreak because there also the E. coli tested very high at that point, and there was contamination of the water due to spillages from the sewages. So at that point here, there was high alert and communities being taught that the water was contaminated and it should be of God. But there was a Chusque outbreak actually that eventually happened in 2023 that was linked to baptism in Chusque and Club Rivers. The water was sampled and the environmental health professionals said they did not detect TB, but there was that hypothesis that those cases of cholera were related to the contamination of the Chusque River. So the recent outbreak that we have had, the cholera outbreak, the cases were reported from the 5th of February this year in Gauteng, Free State, and Limpopo. In total, by 6th of June, 166 cases were confirmed from the lab, and 200 suspected cases of cholera had also been reported in 5 province. And so most cases, they were diagnosed at public laboratories. In total, there were 39 deaths that were reported up to date, and 29 came from Gauteng. But of note, the cholera outbreak is not only limited to our country. So in Africa, as you can see in this map, so there have been other countries that have been reported to have cholera cases. And some of the cases that we had in South Africa were cases that were reported from Malawi, because Malawi had very high cases of malaria. So we have had a couple of cases of following sequencing that were recorded as imported malaria. So the people that visited Malawi and came back to South Africa and presented with cholera. So Hammanskraal, as I mentioned, was the most affected, and 23 people died due to cholera. But currently, it is said, according to Water Research Commission, the Hammanskraal outbreak is not related to the water. The source is not known for outbreak. It has been said the Roerval water tank, there are issues there, infrastructure issues that are there, but yeah, the report is in process, but it is said it has not been confirmed that it has been the source of the cholera outbreak. So also this year in Durban, some of the beaches have been closed down in Point Ushaga, Southern North Beach, Petrie and Cloudy Cove. It was reported that there were very high levels of E. coli in the water, and waters have been closed. I know in Durban, there's been so many rains that is happening that have actually damaged the infrastructure and resulting in contaminated water. So what is also important to know is how to prevent now these outbreaks. So what is important is to improve the water quality. And as I will go right along and stress on the importance of those that can afford to use the filters. But basically, some places we teach them on how to use jig into the water, but also to promote the proper hygiene practices like hand washing, washing your hands before you make the food, washing your food when you're going to prepare it, and also to educate communities on how to prevent these waterborne diseases. So they are actually pamphlets, would advise for people that are GPs to get this pamphlet and share with their patients, especially if they, consulting with patients with gastroenteritis and dysentery, to help them, educate them on waterborne and to prevent it in future and for those people around them. I found this as a very nice pamphlet from the website of the National Institute of Occupational Health. It breaks it down very nicely, like I have done today, but it's like a 2-pager. It'll take you through waterborne pathogen, easy to read in simple English. There's also another very nice one by Rainwater that also explains what water diseases are and will give you step-by-step in detail on how you can actually combat contracting waterborne disease. So now I will go along into case studies and success stories. With this section, I just want to highlight our role as communities, what we can do to improve our WASH practices, and how technology has actually played a role in addressing the waterborne disease challenging that we are being confronted with. So there is actually a project that was run by an NGO called Tsogang Water and Sanitation in Limpopo. So they're basically teaching these communities how to use water for multi-purposes to try and preserve the water, but still try and make sure it's like high quality water. So this project's name was called Operation operationalization community-led multiple-use water services in South Africa. It was implemented end of 2016 and up until 2019. So the findings from this activity is that the quantity of water use increased by 56%. So water basically was more readily available. So the communities actually love the idea of being able to learn and recycle water and use it in the household, and not struggle with a shortage. And as I said, for people that can afford it, I can advise that they can get water filters. They are affordable ones that are affordable, that easy to install. But when you do get one, you must consider the specific water quality concern, the budget, what you can afford, and how are you going to be able to maintain it. But that's where we are as a country. We need to get water filters, so we are sure that we're drinking quality water. Because there was a talk I was listening to, and someone was telling me even the bottled water is not as safe anymore. So filters can also play a role in improving the quality of water. So with regards to technology, I'm just going to share a video now. It's about a few minutes video that is showing on a purification system that was developed by the Council for Scientific and Industrial Research. This is a leading scientific and technology research organization that researches, develop, localizes, and diffuses technology to accelerate socioeconomic prosperity in South Africa. So basically, this purification system, good thing about it, it's low cost, so it can be used in rural areas. It doesn't use chemicals and loses less energy. So this video will explain it in detail.
Access to water continues to be a big challenge for rural communities in African countries. Many communities do not have infrastructure for water delivery. Instead, they rely on water that is sourced directly from natural water sources, such as rivers and springs. Often, the water is contaminated with microbial and chemical pollutants such as fecal and organic matter. These pollutants render the water unsafe for consumption, as it could lead to both acute and chronic waterborne illnesses. The CSIR is a research partner in a project to test and implement a water purification technology that is specifically designed for rural and remote areas in Africa.
This project consists of technology that is chemical-free and also uses less energy compared to your conventional technology that was adopted initially by the Europeans, and now we want to localize it in South Africa to make sure that it fits the conditions of the South African water resources. The aim of this project is to demonstrate that this technology can treat water to drinkable quality, while sourcing water from different sources such as your boreholes, your rivers.
With assistance from its research partners, the CSIR has designed and constructed a prototype plant that uses the novel technology that was developed in Europe for water disinfection. The plant is currently being tested for river water and will inform the design and construction of the 2 demonstrator plants that will be deployed in rural areas of South Africa and Mozambique. The treatment plant uses an electrode which can be operated using solar energy to remove organic and microbial pollutants from drinking water sources. It has a number of sensors that measures different parameters of water quality.
The prototype, we use it for research purposes, and it's a research platform for designing the demonstrators, which is another phase of the project. This prototype was designed to be robust and flexible and consist of many units. These units include electrocoagulation units, which was developed and sponsored by UCLM, one of our consortium partners in Spain. It also consists of chemical treatment in the form of chemical flocculation coagulation, clarification, as well as filtration. carbon-based electrochemical oxidation units, or CEBICO, which was sponsored by Condias. The entire prototype is controlled by the Hydra Water Quality Management System, or HWQMS, which allows for real-time monitoring and control.
The project Save Water Africa is funded by the European Commission and implemented by a consortium of research parties from Europe and Africa. Included in the African and European project partners are high learning institutions, research institutions, as well as the private sector.
I'm involved in two parts of this project. The first part is the construction and the second is the process. Basically, in the construction phase, we orientated all the devices that you see around here. We had to orientate the filters, the manifolds, the CEBICO units, all of that, and put them together so they can work as a system and perform optimally. In the process phase, what we do is we run the plant, different configurations every day, and we take samples from various points, and we collect those samples and take them to the lab for testing to check the water quality at each stage and at each point of the system.
I work for a company called Virtual Consulting Engineers. We're one of the partners on the Safe Water Africa project in association with the CSR. What we do is our main responsibility is the design of the demonstrator units, and the prototype here is used to give input into those designs. What we do is we have a look at what's happening here, take out observations or take home observations, whatever we see happening here, the data that we receive, the data that we get, we take that back to the office and we use that as input into the designs. This box here is the HWQMS. This is actually the control panel for the prototype, and we get a whole lot of information here, the pressures, pump flow rates, control the prototype from here.
The water purification system will be solar powered, making it self-sustaining and energy efficient. Ultimately, access to safe drinking water in rural and peri-urban areas will promote socio-economic well-being and economic growth.
Okay. So moving right along, another also initiative by CRSI, another water treatment technology, they piloted in 2018 in Mazi municipality in Mpumalanga. This system, they call it drum. Those knows in the villages, they know we keep our waters in the drums. So they just adopted that concept, but additionally, they have made this drum into two compartments. Then each compartment has got 50 liters of water, and it has a device inside. The first step, it will purify the water, so it has a disinfectant. Then the second step will be filtration. It will get rid of the sand. So the great thing about it as well, it can keep the water, so long as the drum is covered, the water is safe, and it has a tap where whenever the household needs the water, then they can get the water out of this drum concept. So from the from the media, it was that this water treatment technology was adopted in the University of Good Use and in this community in Nelspruit. But a success story, and I would like to share, is that in June this year, it was published that the USAID committed to $3 million to African Water Facility, so it can help in water and sanitation projects. So we are hoping that we will benefit from this and it will contribute to our challenges as a country. So now, as I close, in conclusion, I would say let us remember that knowledge is power. So by strengthening advocacy for WASH practices, we can empower individuals and communities to take control of their own health and well-being, and together we can create a world where access to clean water, sanitation, and hygiene is a basic human right. So let's continue to educate, to empower, and to inspire others to join us in this crucial mission of overcoming water challenges. And as I close off, I will close off with a diary from one of the Hammanskraal people during outbreak. And then after that, I will take questions.
Yes, we are tired as people of Hammanskraal. The water is tea. It's tea now because the stomach now run. We run. This is the water. We are tired. We are tired because when you go to toilet, the whole day, you sit the whole day. We are at hospitals. We are at Jubilee Hospital. We are tired. This water is running us to toilet. We running the whole day. It's running us in the stomach. Our stomach grrr, 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 grrr. You don't know what is the children or the big person. The big person is sick or the children is sick. The whole house, the whole house like in the house. We don't know because when you just sit, we don't understand if this thing will ever. Mr. Malema must come to Hammanskraal and fetch water and give water, because water now is tea, because we don't know, we don't understand. Yes, as people we are tired, because even the small children is tired, because it's drink, because children is drink water, school water, and then we go and then we want to bath and then we want to do everything.
Thank you. I'll hand over to Dr. Mzukwa.
Oh, thank you. Let's ask Dr. Mhlengi to take us on. Dr. Mhlengi, over to you.
Okay, thank you. Thank you, Chair, and thank you a lot, Dr. Ntokozo. So this was a really great presentation, and we have we have a few questions. So one from Dr. Bazenhot. I hope I pronounced your name correctly. So Dr. Bazenhot asks, what are the first and most obvious signs of cholera? If I find myself affected, how can I best treat myself how can I best treat myself if formal healthcare provision is not readily available? Can you tackle that one, Ntokozo? We'll just take them one at a time.
Oh, okay, Sam. Okay, thank you for that question. So with our cholera, the distinguished feature is that what we call the water rice stool. So usually you will get severe diarrhea, to be very, as that woman was explaining on the video, like water. So you will be passing watery stools. You may get the fever. But how we advise with regards to the important thing is rehydration when it comes to cholera. Yeah, but the first thing is important is you have to get to a facility somehow. As you have seen with the Hammanskraal, they were bleeding. They were making sure that someone is being treated, because the drip is the best. IV hydration is the best. But if you're not able to access it, then you can be able to make your oral rehydration solution. And as you lose stool, and you replenish as you lose. That helps.
Oh, thank you so much. I hope that does help Bazenhot. And then there is Dr. Gundo. What are the lessons learned from the cholera outbreak in Hammanskraal? Yes.
Yeah, I'm not sure. So yes, I would say that the lesson then is preparedness, and that we should be prepared. And I think as the government currently is in place, is that we must look at the water quality, which is very important. And as I said, educating communities on the water they're drinking, just to make sure they are drinking clean water. And yes, sites should also be prepared that in case it comes, because I saw in the recent paper, they are anticipating that it could be a potential outbreak, because they are still struggling with the rival infrastructure in terms of improving it. So it's just to get all facilities to be ready in terms of building extra sites and beds and everything to be available in case they have many high cases of cholera. And so also, as I keep saying, to educate communities on it so they can present to facilities early on when they still have mild symptoms, instead of them presenting late and the health system to be overwhelmed when they present when they have severe diseases.
Dr. Nkube, you muted.
Oh, sorry. Thank you. Okay. Yes, and then the next question would be the role of wash fits in addressing the water and sanitation challenges in health facilities. Limpopo is the only province implementing wash fit. That's from Kundo Topakal.
Dr. Musumela, you also muted.
Yeah, I would say the role of watch fits, yeah, it's to actually guide all communities in terms of, but I guess I kept mentioning Limpopo because they are the ones with the most lacking resources in terms of water and sanitation. That's why all studies tend to zoom and focus into them. But I guess it's actually across the country, we can actually teach all communities about this tool to guide them how to make sure they improve the wash practices.
Okay, thank you. I hope Gunda was well answered. And then we do have another question from Miriam Derrick, which says, what about increasing a little the salaries of community healthcare workers and let them collect water samples for quality control and then enforce local authorities to act upon them? The situation is still very poor in rural North Natal. So I suppose it's the role of community healthcare workers in collecting water samples for quality control. That's the main question. Thank you.
Yeah, I think that's one I'm not the best person to answer. Yeah, I think it's an idea. I think that can be run with the Department of Health. It is a good it can be a good initiative, yes. But I'm not the best person for this question.
Okay, thank you so much, Dr. Mzimela. I think those are all the questions that were on the chat board. I suppose there's no further questions, in which case I can hand over to Dr. Mzukwa for closing. Thank you. Chairperson, are you in?
Oh, thank you very much, colleagues, and thank you very much to Dr. Ntokozo Mzimela for that insightful presentation. Colleagues, I think we all heard it. It's upon us now to go back to communities and assist in whatever way we can. But as the South African Medical Association, we also have a challenge of advocacy. We've got to fight for our communities to get clean water and making sure that whoever is responsible is taken to task. And I do think that it's our responsibility to work together. So thank you so much, colleagues, and have a wonderful night and a peaceful sleep. Thank you very much.